much for joining our production, Scenes from the Hill. We're going to begin by showing you what not to do when you're meeting with a member of Congress, followed by what you should do when you're meeting with a member of Congress. So I want to take a minute and introduce our cast. I'm Jennifer Bernstein, and I'm going to be the narrator, and I'm a senator today. To my left is Taylor Gilliam. She's the principal at Inside Pitch Government Affairs, and she's going to be my legislative aide. Advocate number 1 will be played by Sarah Kucharski, the CEO, chairman, and founder of FMD Chat. Advocate number 2 will be played by Robert Ostrea, co-founder and board member of the Little Miss Hannah Foundation. Raise your hand. Advocate number 3 will be played by Michael Illians, the vice president and director of advocacy, Pediatric Hydrocephalus Foundation. Thank you for taking the time to entertain, and here we go. Scene 1, what not to do. Okay, we're gonna just stop because they're coming into this meeting and they have no idea what they're saying because they are talking about it as they're on their way in, and it looks a little disorganized. You wanna make sure that you coordinate with your team members before you come into the meeting. Make sure that you're early. Please do not be late.
Who are you? I thought we were meeting with the senator.
Pretend I'm not here. I'm not in the room yet, okay?
Want to do that line again?
I'm not in the room. Go.
Who are you? I thought we were meeting with the senator.
Nope, just me. So why are you here today?
Your phone's supposed to ring. Is it ringing yet? Oh, so I'm sorry. First big mistake. Okay, so we have 2 things here. The first big mistake is do not be disappointed if you walk into a meeting and you're meeting with the legislative aide, because the aides are really gonna be your best ally. The second mistake, please don't answer your phone in the middle of the meeting, and please turn your ringer off. Please don't have it play ringtones of Britney Spears or B-52s. Justin Bieber, please, God, no Justin Bieber. Please do not answer your phone in the middle of a meeting.
We're talking at the same time. Hi, I'm Michael. I just want to talk about certain... We'll talk at the same time. Okay, so, okay. I'm Michael Illians. I'm with the Pediatric Hydrocephalus Foundation, and we're looking for the Senator's support of H.R. 3731, the Rare Disease Fund Act.
So here's another problem that we're going to have. You can't go into a Senate meeting and talk about a House bill. You just want to be sure. It has happened, and I used to work on the Hill. Taylor, too, we can tell you, people will come in and talk about state bills. They'll talk about House bills in a Senate meeting or Senate bills in a House meeting. Please know what you're talking about and who your audience is when you go in there.
So I'm so glad that you could take this meeting today and spend time with us, because I mean, this is like a really important issue to me, and it's like affected my life for like a really long time, and like, I mean, it's really sad, and like my pet goldfish isn't gonna have anybody to take care of him if I don't like have treatment, and
I kind of want to let her keep going, but I should stop it. So here we go. It might look ridiculous, but this actually happens a lot, where you'll get nervous, you'll be in a meeting, you'll kind of go off script, and you'll start talking about your pet goldfish or something. If you don't have a defined ask, you've lost your audience. And if you don't have a defined ask and you keep rambling on and on, everyone's gonna kind of check out. So you need to be sure that you're focused. You need to keep the attention of the aide or the legislator. You need to keep them engaged, and you need to be specific about what you're asking for.
So I have a daughter with a rare disease, and one of the issues that we've been facing in our state is the step therapy and the legislation surrounding that. It seems kind of, absurd that we have to go through different trial levels and different varieties of medication before we can get to the one that really works. And that might be related to the Rare Disease Fund Act, H.R. 3731, I believe it is. I think that's the one that authorizes a pilot program that allows the NIH to establish a privately owned and operated investment fund.
kind of want to let him keep going too, but I have to cut in. So here's a couple of things that were wrong here. First of all, I speak from experience having been on the Hill. Taylor will agree. There's nothing, well, there are things worse than this, but highly irritating is when somebody will come in and meet with you and they'll just be reading off a paper. Like they're not personally invested in what they're saying, or they haven't taken the time to get to understand what it is that they're advocating for. You want to be sure that you understand what you're talking about when you go in there, because I think you'll be taken a lot more seriously if you look like you've actually put some thought and some preparation into your meeting. The other thing, again, talking about something that's a state bill in a Senate meeting, can't really do anything for you there.
Well, it was nice
Meeting you.
Hi. I have
They
a lot of-
forgot to leave business cards and say appropriate goodbyes. You don't have to hug and kiss, but you probably shake hands. I don't know.
Hi. Hi. I want to leave you some information, and it's just a little bit, but if you could like read all of that, I'd really appreciate it. Okay? Thanks. Bye.
Okay, So what do we see here? We saw two guys run out of the room and not leave a leave behind or contact information, so we have no idea how to get in touch with them or really about the organizations. And then we had a crazy person leave 10 volumes of things that nobody's ever going to read. So what's appropriate is to bring a one sheet about the bill that you're talking about, your business card, and then maybe a one-pager on your syndrome that you'd like to share. You also want to make sure that you follow up after the meetings. You want to text or tweet pictures, and then you want to be sure that you post that on your members' Facebook page, thanking them and their staff for the meeting. And then what you want to do after you leave is to be sure you follow up in a couple of days over email and make sure that the staff are still focused on what you went in to go meet about. Okay, so that was a disaster. We're going to try to do this again the right way. Don't do anything that you just saw us do, pretty much. So now we're going to do Scenes from the Hill, Act 2, How to Coordinate a Successful Meeting.
Hi. I'm Robert. I have a daughter with the rare disease. I'm here to ask the senator to join the Rare Disease Caucus. What's your ask?
I'm Sarah Kucharski. It's wonderful to meet you. I'm a fibromuscular dysplasia patient from North Carolina, and I'm here to ask the senator about the OPEN Act.
I'm Michael Illians, and I want to ask the senator to support the Patient-Focused Impact Assessment Act, S-1597, and I have a son with hydrocephalus.
Okay, great. So, Michael, why don't you introduce the
Sure.
group and go with your ask, and then Sarah, you go ahead and introduce yourself and talk about the OPEN Act, and then I'll conclude by asking her to join the Rare Disease Caucus.
Great, thank you. Let's go. Hi, Taylor. Hi. Nice to meet you. I'm Mike Illians. This is Robert and Sarah. So thank you for taking the time. Again, my name is Michael Illians. I'm with the Pediatric Hydrocephalus Foundation. I have a 10-year-old son with the incurable brain condition hydrocephalus. He's had 13 brain surgeries to date. He is nonverbal and has a lot of development delays, and we're looking for support on various bills. And I'm with Robert and Sarah. We may be here for different reasons, but we all have a common goal, and we'd like to ask the senator to support the S-1597, which this bill will incorporates the patient voice into decision-making at the FDA and will enable the FDA to use specific tools to elicit patient input when making drug approval decisions. We ask the senator to support S-1597, the Patient-Focused Impact Assessment Act. Thank you for your time.
Yeah, thank you.
And like I said, my name is Sarah Kucharski, and I'm from the Charlotte area. I hear you're from that area as well. It's great to make that connection with you. It's been really interesting for me kind of over the years trying to be in an area that previously didn't have a lot of medical treatment available to me, but now I'm in a more major city, not mine. And I'm finally able to maybe have some hope because my medical history has been really complicated. I had renal, celiac, and mesenteric bypass when I was 24, and the bypass actually ended up failing. And after that, I had a stroke at 27 and lost my kidney and had 4 brain aneurysms and a gastric rupture. And for me, my disease is severe, but I think about all those patients who are like me, who they have no treatment and no cure. And that's why I want you to ask to co-sponsor the OPEN Act, which it has bipartisan support. And it will work with approving already approved drugs, repurposing them for other people in the medical communities. And that process will also help reduce costs for those of us who are already facing a lot of financial burden.
First, thank you so much for taking the time to meet with us. We really appreciate it. I know your schedule's very busy. As I mentioned, my youngest daughter, Hannah, was diagnosed with an ultra-rare genetic disease. It's called Gaucher type 2-3. It's a developmentally debilitating disease that affects both the mind and the body. Most kids who are diagnosed with this disease typically don't see their 4th birthday, and there is currently no effective treatment, and there is no cure. My daughter, Hannah, fell within those timelines, and she passed around 5 years ago at the age of 3.5. And during that 3.5 years, our main priority was to keep her comfortable, was focus on the quality of life. Because we knew, after meeting with numbers of medical physicians, pharmacists, taking trips to the NIH, the FDA, that there probably wasn't going to be an effective treatment, let alone a cure, in her lifetime. So quality of life issues became very important for us. So we created a nonprofit organization called the Little Miss Hannah Foundation. This is a group in our area that helps other families who are dealing with or caring for children with medically fragile conditions and debilitating diseases, help them care for their kids with a focus on the quality of life. And here's a little information sheet on Little Miss Hannah Foundation. My daughter is in the middle there, as you can see, with her older brother, Ethan, and Abby. And, she's very happy. She was a very happy child, and that was our main focus. And so since her passing, and as we're helping other families, quality of life becomes an issue. And, there are over 7,000 rare diseases in this country, or in the world, and 1 out of 10 Americans are living with a rare disease. So it's a major issue, and as such, we'd like to ask the senator to join the Rare Disease Caucus, and here is some information on that.
Thank you.
There is a briefing tomorrow at noon that I'd love for the senator and perhaps yourself and other staff members to attend, and hopefully we can bring about additional awareness, not only in Congress but in the public for rare diseases.
Great. I will put the event on my calendar and pass it along to the scheduler so she can put it on the senators.
Hi, so nice to meet you. So sorry I only have a minute. I'm super important. Hi, I'm super important, Senator. Hi, I'm so important. I only have a minute. Can I get a picture with you guys so I can prove that I came into this meeting? Thanks. Hey, thanks. It was so nice to meet you. I gotta go do important stuff or nothing. Thank you.
Well, that was great. We were able to meet the senator.
Yeah. Oh, thank you.
Oh, you got more lines?
So,
So here's my business card.
oh, thank you very much.
Absolutely. Appreciate it.
Thank you, Taylor.
Great to meet you.
Thank you so much.
Yeah, of course. All right,
you.
great to meet you guys.
Well, that was a great meeting. I'm going to be sure to set a calendar on my Outlook to make sure that I follow up next week to see if they've joined the caucus.
Excellent, and I'm going to make sure that I get a copy of that photo and tweet it and put it on Facebook and tag the members and get in touch with the staffers and really share it so that everybody knows what we've done here.
It's great. I'm going to do some follow-up emails when I get home. This is great. We made a lot of progress.
Off to the next congressman.